I want to thank each and every one of you. Most of you came in quite early, and I thank all of you for being here on time. We're going to start with a prayer, and it's our national prayer. If you can stand, please. Today is a great day. It's a great day for two organizations, CDC Foundation and Mhealth Kenya, and so many other organizations that are here that have been part of a journey. I think a four-year journey, and we are here to celebrate that journey. There are a lot of partners here that we have worked with. And there are a lot of people here that we are going to be working with. And the most important partners who have made this journey possible are the Ministry of Health. You cannot be Mhealth without health. And Mhealth has happened, and CDC Foundation has been able to implement Mhealth products because of a ministry that we have worked very closely with. This is the Ministry of Health, and its departments and its units. I would like to, however, welcome you. This is a breakfast that's supported by a marriage of CDC Foundation and Mhealth Kenya, so we cooked it. Yeah, I mean, if you come to my house, even if I didn't clean it, if somebody else cleaned it and I paid them to do it, I cooked, I cleaned. So yes, we made this breakfast for you. So I'm going to start off by inviting one of our guests, Dr. Martin Sirengo. Martin Sirengo is the head of NASCOP, and I would like you to come and represent.
So I don't have really written remarks, but I just wanted to reflect on the journey that we've traveled together with CDC Foundation and now Mhealth Kenya. I remember when I was first introduced to CDC Foundation, I think about 4 or 5 years ago, there was a lot that was going on, of course supporting different organizations, specifically the Ministry of Health, in doing Mhealth projects across the country. And for HIV, we were actually the biggest beneficiaries. We have done quite a lot, especially on issues to do with injection and prevention control. We have a project that's currently running called MPEP, which really enables healthcare workers to access interventions when they have accidental exposures to either blood or injury. And we are very proud to be associated with CDC Foundation. We have also done quite a couple of other things, including reflection on the other activities that go on in this country. In this country where we have over 80% of cell phone penetration, I think we can do much more. And everyone now is using a mobile phone to do one or two things. I don't remember the last time I looked for an M-Pesa, for instance, to make my transactions, because I do everything on my phone. If I want M-Pesa, it's on my phone. If I want to access internet, it's on my phone. If I want to send an email, it's on my phone. So everything really is on my phone. And literally everyone else out there, even in the villages, they have a phone of some sort. It may not be a smartphone, but it's a phone and they can do things with it. When I was coming here, I was actually reflecting on the utility of a mobile phone in my village where I was born and brought up. The first time my mother said she needed to communicate with me frequently, I told her, can I buy you a phone? And she said no. So I asked her why. She said she doesn't have the eyes. She's close to 70. She doesn't have the eyes to press the button. So I told her, can I buy you then a big phone? can see the numbers clearly. And she said, okay, just buy me a phone, and I did that. And nowadays, it's surprising, she'll even send me a please call back. I wonder, where did she learn all these things? So, what I'm trying to say, literally, everyone can use a mobile phone. And for the Ministry of Health, we have many opportunities for doing this. We've been talking about improving our systems for reporting. We have had, of course, many challenges. Many times when you call the healthcare workers to a meeting like this to review their performance, and you tell them, look, this is how you're performing, the first thing that comes out of their mouth is that that's not our data. Reason being, we did not fill the data. It was filled by somebody else. And therefore, the question of validity arises. So if we can re-engineer the way we do business, improve our systems, so that many of these things that we do using the paper manual systems can be done through electronic platform, I think that will be the way to go. And as HIV program, we actually look forward to bigger things from Mhealth Kenya as we start this journey going forward. We have many dreams for the program, and that makes Mhealth Kenya really our good partner going forward. So on behalf of the ministry, please allow me to once again congratulate Mhealth Kenya for reaching where they are, and also say thank you to CDC Foundation. I think CDC Foundation has acted as a good mother to bring up a child who can now walk and stand and do things on their own. So we also need to clap for them. So thank you very much. We look forward to working closely with you. Asante sana.
Mom, did you hear that? I can not only walk, I can walk in heels. Thank you, Martin, for the great and kind words, and we are looking forward to a great partnership moving forward. I would also like to introduce the Kenya National Blood Transfusion Services. Dr. Odur is not here. She is, however, well represented by Charles Kimodo. Karibu.
It's a beautiful morning, and I'm happy to be part of this meeting this morning. We are from the Kenya National Blood Transfusion Service. My name is Joseph Kamugo. I'm not Charles. Joseph Kamugo. So I'm representing my boss this morning. That is Dr. Margaret Oduor. She wasn't able to join us because of other engagements. However, she wanted to be with us, but because of those engagements, she wasn't able to be with us. So first of all, I want to say that I've had remarks here, and I'm going to go through the remarks so that you can have a feeling of what she thinks about Mhealth Kenya, and we're going to proceed. These are remarks by Dr. Margaret Oduor from the Kenya National Blood Transfusion Service during the transition of CDC Foundation to Mhealth Kenya breakfast meeting at Crown Plaza, Nairobi on 14th of August 2015. Dr. Martin Silongo, NASCO, Dr. John Munyu, Chief Executive Officer, KEMSA, Dr. David Soti, Head Health Informatics and M&E Division, Dr. Kali Mwangi, Chief Executive Officer, Mhealth Kenya, Lenny Sanders, CDC Atlanta Representative, Dr. Tom Roach, CDC Kenya Representative, Dr. Linda McGee, CDC Foundation Associate VP Programs, Bella Nasland, CDC Foundation Associate VP Programs, Dr. Reynold Malani, Chairman, Mhealth Kenya, the media. Ladies and gentlemen, I'm delighted to join you at this event when CDC Foundation is transiting into Mhealth Kenya. Indeed, we in the blood subsector are proud to be associated with Mhealth Kenya, and we have always considered them as a valued partner in the service delivery to the people of Kenya. From the onset, let me commend CDC Foundation, as we have always known them for their support in the uptake of health technology nationally, and in particular, the support they have extended to us at the Kenya National Blood Transfusion Service. Ladies and gentlemen, in the last 14 years, we have been in the service. We have endeavored to deliver quality and save blood to the people of Kenya. True to our vision of being a world leader in provision of safe blood for all, we have continued to offer quality service in line with the Constitution of Kenya 2010 that provides for the highest attainable health care for all. Ladies and gentlemen, the demand for blood and blood products have increased over the couple of years owing to the upsurge of terrorist attacks, road traffic injuries, cancer-related ailments, anemia occasioned by malaria, among other diseases. This is, however, taking place at a time when donor funding is on the decline. This scenario, therefore, calls for adoption of renewed strategies and partnerships. Indeed, timely availability of blood is an important component in the effort to save patients from unnecessary deaths. Blood transfusion saves lives and improves health, but many patients requiring transfusion do not have timely access to safe blood. The need for blood transfusion may arise at any time in both urban and rural areas. The unavailability of blood has led to death and many patients suffering from ill health. To mitigate this scenario, we have adopted various strategies, including targeting the adult donor and upscaling effective donor education and communication. We are also encouraging walk-in blood donors to our facilities across the country as a measure of reducing the cost of collecting blood. Currently, we are serving close to 470 transfusing hospitals nationally with blood and blood products. These facilities are public, private, and faith-based. We have also stepped up our hemovigilance capacity to guarantee safety from our end at the facility level. I'm happy to note that a short text message platform dubbed Text for Life that was launched last year has helped KMBTS capture blood donor biodata and has enabled us to communicate with blood donors. To date, a total of 90,000 blood donors have been entered into this system. This system has now enabled us to acknowledge donors shortly after donation, notify them their next donation dates, and recall them, especially when a layer blood group is needed urgently. Indeed, this milestone would not have been attained were it not for the support, both financial and technical, from CDC Foundation. This is now Mhealth. Indeed, we are very happy and we are grateful for that input. The intended rollout to our 20 blood collection and testing centers nationally will no doubt require high-level partnerships from development partners and stakeholders. I therefore would request Mhealth Kenya to consider working with us on this project. Indeed, we envision a situation in the near future where we shall be able to reconcile all our data management tools, including monitoring and evaluation manual tools, Text for Life system, and BEX, to have a single blood donor data bank. This will further enable us to get timely and accurate reports and will significantly enable us reduce cost of conducting our business. Finally, ladies and gentlemen, allow me to once again thank Mhealth Kenya most sincerely for being there for us, and at the same time wish them well in their endeavor of supporting health technologies in Kenya. Thank you.
Thank you so much, Joe and the Kenya National Blood Transfusion Services. We are looking forward to a long partnership, and I know we will work well together in the future. I want to introduce another gentleman. When I started working with CDC Foundation, one of the organizations that I was asked to work with was KEMSA. In the past, every time I read about KEMSA, it was never very positive. And I remember at the time, Dr. Munyu, who is the current CEO of KEMSA, was I think acting at the time, and I remember him sharing a vision, and I didn't really know or think that I would be part of that vision, because half the time when I walked around KEMSA, I was very scared, worried, wondering how I was going to get this project through. But he one day told me, Kathy, when you come to KEMSA, walk with your feet firm on the ground, we will do this. And I did. I stayed through hardships, through a lot of difficulties, not because of the people I was working with, but because I was worried about this vision that we had. Today, I am happy to say that we have been part of getting KEMSA to be a paperless organization. And I don't take credit for everything. There have been many, many people who've made KEMSA get to where they are. And today, I am extremely proud to be part of KEMSA's progress, and to also invite Dr. Munyu to come and share with us. Dr. Munyu, the CEO of KEMSA.
My colleagues from the ministry, guests from CDC Foundation, guests from CDC, other invited guests, and all protocols observed. To me, when I started here this morning, it's a sense of great pleasure, just to echo what Kathy has said. The work that we do as the Kenya Medical Supplies Authority is to support the Ministry of Health in ensuring that the medical logistics management part of the healthcare delivery is properly managed. And that's what we do. We have come through a big journey. There has been a lot of transformation in this organization, as she has said. And it is true, as Kathy has said, that we have come a long journey. Indeed, CDC Foundation and Mhealth have been truly great partners in KEMSA's progress. Today, Kenyans from remote areas, Kenyans from areas that are not privileged in many ways, the northeastern areas and other areas of the northwest, where internet connectivity is a problem, where communication applications like we have the laptops and the iPads and the notepads are not available. Those Kenyans can place their orders for their medicines, for their medical commodities to KEMSA through the mobile phone. Thanks again to Mhealth. They can be able to report their consumption data directly to the KEMSA ERP platform through their mobile phones. And they can be able to channel their complaints to KEMSA straight to our enterprise resource planning platform, because we have an e-mobile application called KEMSA e-mobile, which is an application, and for those of you who have Android phones at the moment, it's an application on your Android phones, and you just go to that application and you can get in touch and you'll be hooked to the KEMSA ERP system, and you can be able to talk to us. We want to assure you that the Kenya Medical Supplies Authority will continue working with Mhealth. We have a lot to do. Our goal as an authority is to ensure that we improve access to healthcare, is to ensure that we lower the cost of healthcare, is to ensure that we improve the health outcomes at the counties, at the national level. And we can only do that if we continue improving service delivery. And how do we improve service delivery? We can only improve service delivery if we have operational excellence, operational efficiency, if we are cost effective in what we do, if we have quality systems. And quality systems begins with a seamless flow of information from our customers to the patients, to ourselves, from top to bottom, from bottom to top. And that we cannot do without the kind of technology that we have brought to KEMSA. And we look forward as CDC Foundation. I know I don't see you often, but you are good partners to KEMSA. As you hand over the baton to Mhealth, I can assure you we have been working together for the last 1 year now, and when you are not so much in the scene. I think you're in good hands. And for Mhealth, there's a lot to be done, there's a lot we can do, there's a lot that you're going to do, and we are committed to keeping the promise. I think we achieved the vision. Kathy, I told you, we'll be paperless. We'll depend on nobody's money. And we will be on the international scene. Indeed we have, and you have been a partner. Thank you, and we shall continue being together. Thank you very much.
Thank you so very much, Dr. Munyu, for your kind words. I'm so humbled. If my head could get any bigger, for every time you mentioned my name, I would need a crane to get out of here. Thank you. Again, this has been a journey, and it wouldn't have been complete if I didn't, or my team and CDC Foundation did not work with eHealth. Like Dr. Munyu said, the Ministry of Health, and that's the Division of Health Informatics and Monitoring and Evaluation, held their first ever eHealth conference last week. There were great brains there. There was international representation. I know as we were working with Dr. David Soti and his team, Onesmus Kamau and Anne Barsigo and Valeria, all the guys who work with Dr. Soti, when we were planning it, we did not imagine it was going to be a success as it was, with so much output from it. I am proud to have been working with Dr. Soti. Dr. Soti has been guiding us, Dr. Soti and Onesmus, and I would like to invite Dr. Soti to come and give his remarks, and I also thank you for being here with us.
I want to thank you very much again for what you helped us through doing the eHealth, the eHealth conference that ended last week, and we are happy that we achieved a lot, and from that actually we have learned. Our role really in eHealth and Mhealth, part of it is to give strategic direction, to have governance in place, and to be sure that what is happening within some framework that at the end of the day you will be able to tell that we are developing or not developing and change things. So just to give you a brief, right now we're not in any environment where there is no policy, where there is no a framework. There are chaotic situations. That may be the problem at the moment, but we have in place a roadmap through which we'll be able to give the policy, which is now in development, together with the review, the strategy. We already have eHealth strategy, which was 2011-2017, but all of you know, because we're in technology, that technology changes very, very frequently, and a lot of things have come into being that were not foreseen when we were developing the eHealth strategy. And for that reason, we are now revising it to have it as inclusive as possible. And a number of you probably, if you don't already have the invitation letter with you, it's going to come, so that we get your opinion as we develop this document, the eHealth strategy, the enterprise architecture in the health sector for eHealth issues, and also the strategic plan and policy, so that at the end of the day, you as developers, as implementers, as users of these softwares have your say in how we do things in Kenya as far as eHealth is concerned. And that is my goal in making sure that we reach the end and become a shining star that we are. Right now we are a shining star without that coordination. When the coordination comes, I don't know what we will be, but I'm looking forward to seeing that happening in Kenya. Thank you very much.
Thank you very much, Dr. Soti. We look forward to working with you, and Mhealth Kenya is going to continue developing mobile applications, and all I can say is that considering the penetration in mobile technology in this country, even if we were the only mHealth developers, we would not fill that gap. So we are going to continue working with all the mobile technology solution companies, and I'm sure eventually we may bridge that gap. One company cannot do it alone. We will have to work together and collaborate to be able to fill that gap, and we will continue to do that. It was just by mere luck that Mhealth Kenya was Mhealth Kenya, and it looks like we are the only ones, but I know we are not. But we are open to working with each and every one who is developing to fill that, to bridge that gap. I want to take this chance to invite, I don't want to call her my mother because she will end up calling my mother, but she really is my sister. We started working with her again a few years ago. Even though she was working over 12,000 miles away, each and every day has been a learning lesson, I'm sure from her end and mine. I have been able to learn a lot from her experience, and she was really my boss. And but over time and over working with her, we have developed a partnership, a relationship, and even as we delink, we will always be very close and tied together. Linda, my friend, karibu.
Good morning. I would also like to welcome all of you this morning, all of the partners who have worked tirelessly with Mhealth Kenya over the last few years. And now we've heard from a lot of the implementing partners working with Mhealth Kenya, and now I want to fill in the background for you a little bit about the project overall. Yes, thank you. About the project overall. And part of that background is our work with CDC. We were funded by the President's Emergency Plan for AIDS Relief, which is PEPFAR, and of which Mhealth is part of the cooperative agreement. So before I start talking anymore, I'd like to have CDC Kenya's representative, Dr. Tom Olwach, come. Tom's been engaged in this project longer than me and has seen things change over the years, and so I'd like to welcome you to the stage and welcome your perspective. Thank you.
So it's a great pleasure to be here today to witness this key milestone in the project that I've been part of since 2007-2008. I was initially the activity manager for Funds for Health, and I continue to be involved in this project, although my role has changed. I'm currently the acting branch chief for health systems and evaluation, which houses this project within CDC Kenya. The project started off as Funds for Health in 2008. For those of you who've been engaged with the Ministry of Health long enough, you'll remember the Funds for Health project that started off way back in 2008. And it was implemented by a partner called Voxiva. It was an initiative driven by PEPFAR headquarters to promote public-private partnerships model as a way of achieving sustainable application of mobile technology in the delivery of healthcare. And the main aim of this project was to build a foundation for an integrated national mobile-based health information systems in Kenya through a PPP model. Although the plans were great and the presentations were great, I don't know if any of you here ever attended presentations by Voxy, but they were really very good presentations. Unfortunately, the intended objectives were not met. And both the client, which is the Ministry of Health, and the funder, and also provider, who also provided technical oversights, that's CDC Kenya, got very impatient with the project and ended it prematurely in 2010. But we learned a lot from our failures. We learned great lessons. And we went back to the drawing board and took a very different approach to PPP that applied context-appropriate technologies and a stronger engagement of the local industry players. We learned that our chances of success were better if we built on locally developed and supported technology platforms that are flexible, scalable, and robust. So the next big thing that happened in 2011 was the CDC Foundation getting engaged more actively and engaging local organizations through Mhealth Kenya. And I must say that the name had to be changed. We had such a bad name at Afya House, we had to do something different. And I remember the former director for public health, Dr. Sharif, each time he saw me, I had to tell him, I'm not here to talk about Phones for Health this time. I'm here for other informatics stuff that CDC supports. So we had to relabel, we had to just rebrand totally. And that's when Mhealth Kenya came into play. So then it shifted completely from Phones for Health to Mhealth Kenya. It had to have a different identity, different focus, and a different approach.
And last but not least, Kathy Mwangi. Please join us. She is the very soul of Mhealth Kenya itself and a true leader in the mobile health industry in this country. I'd also like to take this moment to invite our chief guests to join us here so that we can actually go through the launch of this strategic plan. I'd therefore like to invite Dr. Sirego is out, unfortunately. So, Tom, please join us on the stage. Dr. Linda McGehee, please join us. Vala Nesman, please do join us. Dr. Munyo, we cannot forget you for sure. Dr. Soti, please also join us as we launch this strategic plan.
Napigiwa simu na nashukuru kwa kuletea. It's now time for those who are going to be implementing this particular plan to come forth and be saved. So Kathy, please.
Today we celebrate an ending and a beginning. Mhealth Kenya started off as a project name, an Mhealth Kenya public-private partnership. This was a CDC Foundation project that was meant to use mobile health innovations to bridge existing public health gaps. Kenyans are the most innovating human beings that you will ever encounter. If you do not know how innovating we are, just join Twitter. And you just need to piece one of our loved ones and say something we do not like, and you will face the wrath of Kenyans on Twitter. Popularly known as KOT. Last year, the mobile phone penetration hit 80%, and the smartphone penetration was at 67%. That means that 67% of the people walking around with a phone actually are walking around with a computer in their pockets. Smartphones in Kenya have become very affordable, and anyone can own one. Kenya has become a hub for many technology companies, and what excites me is that our universities and colleges today all have computing and innovative departments, and we are producing some of the smartest students. While the likes of Safaricom, HP, Oracle, and the rest are working on improving our ICT infrastructure and our connectivity, our government is pushing for more digital platforms and processes. Last week, our Ministry of Health held their first e-health conference, and soon our hospitals will have electronic medical records that access through mobile technology. Mhealth Kenya is committed to collaborating and working with partners to take Mhealth and health in Kenya to the next level. We can make Kenya the most connected country in the world. I know it is possible, and yes, we can. I really thank you for being a part of this celebration. It is quite a success story. I want to give my vote of thanks as we come to the end of our celebration. This would not have been what it is if it wasn't for each and every one of you, but I know this may sound like a cliche. Every time something good happens, we all say that we thank God, but this is not a cliche in our books. Mhealth Kenya is a very prayerful team. We pray for everything we do, and we've become close, and we've become what we've become because of God, and I thank Him, because this would not have been possible without God. I would like to thank CDC, and especially CDC Kenya, Tom and your team, CDC Atlanta, Renee, you are amazing, and I've learned so much from you, and thank you for your advice, for holding my hand through the process. I thank the CDC Foundation team for being with us, for being our mother, now our grandmother, and for mentoring Mhealth Kenya to where we are today. I would like to thank the Ministry of Health and its entities. We have worked together, and we will continue to work together. The eHealth unit led by Dr. Soti, working with Onesimus and Anne Barasigo and the rest of the team. Dr. Soti, we will be partners. We will continue to work together, and yes, we will continue to write those grants together. And I believe the next eHealth conference will be bigger and better, and we will be a part of that. I would like to thank the KEMSA team. I would like to thank the NASCOP team led by Dr. Martin Serengo, who took his time to come here, even though he had a bigger event going on, but he came and he stayed with us. I want to thank him. I would like to thank the whole Kenya National Blood Transfusion Services led by Dr. Margaret Odward. I thank our partners, many partners we've worked with, and those who we are still trying to work with, and we will continue to work with. I may not mention all, but I know some are represented here. FinTech, you've worked with us through the KEMSA e-mobile. GEMRA, the ART guidelines. EMP with the MPEP, IntelliSoft with Text for Life, iTech, we've worked with you guys, we will continue working with you guys. Futures Group, now Palladium Group, it's been great working with you, we will continue to work with you. And we have a lot more that we are going to be working with, Tangazo Letu, EGPAF, Strathmore, Kenyatta University, well represented here, all the academic institutions, and everybody who have not mentioned, we will and are looking forward to working with you. Bloodlink Foundation, represented here by Joe Wangendo, you've worked with us with the Text for Life system. You continue to mentor us. Joe Wangendo is currently the CEO of St. John's Ambulance. We will be working with you. And I thank you for your representation. I would like to thank my board. They're a young team, but they come with a vast of knowledge, and I'm learning so much from them. I would like to thank my Mhealth Kenya team. Wherever you are, if you work for Mhealth Kenya, or you consult for Mhealth Kenya, or you are looking to working with Mhealth Kenya, can you stand up? Thank you, you can have a seat. I love going to work, and I enjoy my job. And I look forward to seeing those people every morning. I'm about to tear, but I want to thank each and every one of you. I am where I am today because of you. And finally, there is a very beautiful woman sitting in your midst. Gladys Pungi Awon, because of the days and nights she has knelt praying for us. Thank you. Thank you, everybody.
Thank you very much, ladies and gentlemen, for gracing this occasion. You can now leave at your own pleasure. Thank you again.
Mhealth Kenya is an organization that started off as a branch of CDC Foundation. It actually came about to bridge gaps between e-health. What happens today is that e-health is a platform for getting us to the digital world, and Mhealth Kenya is just a component of e-health. So we have hospitals that require electronic medical records. For example, we need to collect data. We need to be able to get the facilities that are in the most remote areas being able to connect to the Ministry of Health. How do you do that if you can't have the infrastructure that can support computers, that can support that electronic health record or electronic medical record? You do that by use of mobile technology. Mhealth Kenya has been coming up with platforms that can be able to bridge those gaps. Kenya Medical Supply Authority has facilities that are not easily connected, but using the mobile platform, they can report stockouts. So again, that bridges the gap and it narrows the issues that KEMSA has had before. Text for Life is a system that connects the blood donors and allows blood donors to enroll to become donors. And now it means that the Kenya National Blood Transfusion Services can tell them where there are blood donations. They can be told when they need to go and where they need to go and donate blood. The system links them by county. So if I'm in Nairobi, I will know where blood donations are. Once I donate, I will be told where to pick up my results. And that was a link that was not there.
And we have a mobile phone application called KEMSA e-mobile that enables people in those kind of areas, our customers in those areas, to be able to set their requirements to us directly through their mobile phones, and it comes directed to our enterprise resource planning system. They are able to set their complaints, they are able to set the consumption data, and therefore we are able to communicate with them seamlessly. And the information is able to flow, either in those areas where there is no internet connectivity, seamlessly through, of course, mobile phone connectivity and through their mobile phones. And still we are taking it a step further. As we talk, we are busy developing another mobile application, and this mobile application that we are working on is one that will be collecting information at the user point. At the user point, I'm talking about the last mile, where the medicines are being dispensed, where the medicines are being used. So we'll make use of mobile phone technology to collect that information, to be able to report what is happening, to report on healthcare products being dispensed, the activities taking place there, the disease patterns and the patterns that they observe, and that data will be very important in decision making, because it will inform us in quantification, in forecasting of our requirements. And therefore we continue investing in mobile phone technology or digital technology, and we continue also in embracing e-health by making sure that we automate all aspects of what we do in managing the supply chain.
In 2010, we engaged with CDC Foundation, and then they were the primary recipient of the PEPFAR money, and that's through CDC. Then they had Mhealth Kenya as a sub-recipient, or was the technical implementer of their project. And this has gone on very well. So we feel that CDC Foundation has properly incubated Mhealth Kenya and prepared them to independently apply for a grant which they received. So now they have 5-year funding from CDC, which they're going to use to implement Mhealth solutions in Kenya.
When I look at Mhealth, Mhealth and eHealth, they are interrelated, because Mhealth is one of the pillars within the eHealth strategy. From our eHealth strategy that we are actually out to launch in the next couple of months, we have actually tried to bring out the issues of mHealth stronger than they were there before, because we have seen so much growth in terms of mobile applications that are supporting reproductive and maternal child health, others supporting like what you have seen with blood donor, text for life, those kind of innovations. So we want to see that we can actually be able to do more in terms of innovating in the mobile area, so that we can actually be able to improve the accessibility of services even in the remote location in this country.
Maybe finally, with the challenge of fragmented funding,